Hi, everyone. Who is with us today? Well, it's Laura from The Baby Journey. And today we are talking about breastfeeding woes. Actually, I'm going to say most lactating mums experience challenges during their breastfeeding journey. One of the most common we get asked about is blocked ducts and what we refer to as blebs. They are what can often lead to painful latching and pumping and the all-scary mastitis if not resolved quickly. This topic is genuinely close to my heart. I suffered regularly with blocked ducts when I was breastfeeding, and if I hadn't learned techniques to support myself through it, I absolutely know that my breastfeeding journey would have been a lot shorter. So I am pleased to have Laura, an international board-certified lactation consultant, bringing you tips to help you get through this. The legal stuff. The educational content of our masterclasses is the work of our pregnant and popped partners. We are not licensed medical or legal professionals, and this is neither a medical nor legal platform. The content of today should not be considered medical or legal advice. Instead, it is always best to consult with your specialist providers for any specific concerns or questions. And use the information from today as a complementary tool to help guide those discussions and care plans. In short, our goal is to provide a supportive and informative community for expecting and new parents, but it's important that you always prioritise your own health and the advice of your specialist providers. Now, if I can take just a really quick moment to briefly introduce myself, in case anyone doesn't know me, I am Kathy. I am the founder of Empower and Pregnant and Popped. At my core, I am a certified postpartum doula, which means I am in the trenches providing home-based physical and emotional support. Okay, that can be from babies breastfeeding, bottle feeding, sleeping, crying and pooping, to mums' perennial and emotional healing, sometimes even washing the dishes and making healthy snacks. I'm with you in the trenches, wiping your baby's bottom at the same time as mopping your brow or tears. With different tissues, I promise. But this masterclass isn't about me, it is about helping you prepare for the future, so let me introduce our guest. Laura is an internationally certified lactation consultant. You may hear this referred to as an IBCLC. She is also a childbirth educator and postpartum doula with the International Childbirth Education Association. She is also a trained birth doula, but doesn't practice this in Singapore. And she has a Bachelor of Science degree in Animal Sciences, which sounds irrelevant, but she says it really helps her understand the natural side of birth and breastfeeding, as well as parenting. She has been working in private practice supporting parents since 2008. And she says herself that her own breastfeeding journey was a massive challenge. Her words, not mine. So you can imagine that has inspired her and her journey to help more parents. So without further ado, Laura, I'm handing over to you.
So welcome to the talk on navigating breastfeeding challenges. We're going to be focusing on blebs and blocked ducts. So Kathy did a lovely introduction for me, so I don't need to go through all of that, which is amazing. Thank you, Kathy. I do have the disclaimer up as well that this information is not generalized, as a personal history hasn't been taken and a private consultation has not been done. So this information is more general based, and although it is really amazing information and it should help you, sometimes a private consultation needs to be done to dive a little deeper to see what's going on. Always listen to your primary healthcare provider. They have seen you, they know your history, and they are also an amazing person to work with through any challenges you might have. And then I just need to note that there are going to be graphic images shown during this presentation, and these images might include nudity. It's a breastfeeding talk, we can't avoid it. So looking at breastfeeding challenges, I often get asked by mums, why is breastfeeding so difficult if it's natural? And I have to say to mums, we need to look at it from all perspectives. And I saw a Facebook post ages ago. I wish I'd saved it so that I could refer back to this person and give them credit for what they said. But they related breastfeeding to walking. Walking is natural, but when we start with learning the skill of walking, it's not easy. We stand up and initially we need to use support to get through the early stages. The babies hold on to the chairs, they hold onto the table, they hold our hands, they wobble, they fall, they get back up again, they try again. Fortunately, they have nappies to catch them during that fall. But with breastfeeding, we don't have that. Breastfeeding is natural, but it's not easy because it's a learned skill. And it's one of those skills that we don't get to view in nature, if I can call it that, anymore. We tend to have breastfeeding as something private that we do in our own space. And we don't grow up viewing breastfeeding the same way we used to view it in a village setting. So we have to learn not just how to breastfeed, but how to overcome the challenges that we face along the way. I say to mums, remember, you're not alone in this. As Kathy said, so many moms experience breastfeeding challenges, including blocked ducts and blebs. And I remind mums that I built my career on this. That means that there are enough mums out there needing help and support that I can actually make this my full-time job. It's not a great thing. I wish that breastfeeding was easy for everybody. But there are people like myself out there who are there to help you through the challenges that you might face. Just remember, most challenges we face with breastfeeding can be fixed with the guidance of a lactation consultant and a bit of patience. The patience part is important. So looking at blebs and blocked ducts, the two of them are linked. And I'm going to explain to you exactly what a bleb is, what a blocked duct is, what causes them, and then what you can do to fix them. Both are due to a blockage of milk that happens within the breast. A bleb can increase the occurrence of a blocked duct. So it's important that if a bleb is present, that we get it to clear as quickly as possible, but also that mom checks her breast on a regular basis to look for blocked ducts so that we can pick them up early and treat them very quickly. They need to be resolved quickly before they develop into an infection. One of those is the terrible mastitis that we definitely want to avoid. So what is a bleb? A bleb is a milk blister that develops on the areola, and it usually develops on the tip of the nipple. We usually find blebs like this image on the nipple itself, but it can develop on the areola around the nipple. The spot might be white or yellow. The skin around the area or on the area can be inflamed and red. So sometimes we might not notice the little bleb there because of the redness that's there from the other inflammation that's been caused. Latching is usually painful, and it can be felt like sharp shooting pain with breastfeeding or after breastfeeding. And due to this, sometimes a bleb is misdiagnosed as thrush of the nipple, thrush of the breast, because the moment people say sharp shooting pain with breastfeeding, our first thought is thrush. So a bleb is not thrush. It is not a fungal infection. It is a blockage that has taken place. The bleb blocks the nipple duct, which is the nipple opening where the milk comes out. And this is important because if the milk can't get out, if the milk can't flow, it's going to stop the milk from further in that duct from being able to move out. And this is where we see the occurrence of blocked ducts. An important thing to note is that a bleb is not a blister. A bleb is a blockage in the milk duct, whereas a blister is a small bubble on the skin filled with serum. So it's got this clear liquid inside of it. The blister is something completely different. Blisters are related to latching challenges, and they're there because of rubbing on the breast. So sometimes we find it with the use of nipple shields, or when a mum isn't using the correct flange size with expressing. And a blister needs to be treated completely differently to a bleb. A bleb is the blockage. What causes a bleb? A bleb occurs when the lining of the milk duct is inflamed. So this isn't the lining of the milk duct near the nipple. I'm talking about really deep inside the breast. When we have inflammation of the milk ducts, so inside your breast, you've got a number of milk ducts, and the worst description of it is that it's like grapes, but it's not round grapes, they're elongated grapes. So you've got this little network of these grape-like structures inside your breast. And what happens is sometimes one of those can get damaged. That damage can come from a breastfeeding challenge. It can come from an infection. It can come from the breast being bumped or hurt in some way, and it causes inflammation inside the breast. This inflamed tissue then starts to break off, and the skin cells that break off can occasionally block up at the tip of the nipple. When they block at the tip of the nipple, the skin cells or epithelial cells of the breast cover over that opening, that duct. And then we have this buildup behind that causes a little white spot on the tip of the nipple. It is not linked to latch issues, and it's not thrush. Why I say it's not linked to latch issues is it's not the actual latch that causes a bleb. It can be that baby is latching incorrectly due to another cause. So a lot of times people think that a bleb is related to latching issues. Correcting the latch can help the bleb, but it's not just correcting the latch, it's correcting the underlying cause behind the latch challenge. That is our big go-to when it comes to blebs. Usually blebs are linked with hyperlactation. Hyperlactation is an increase in milk supply, where the breast is making much more milk than the baby needs. And what happens is after baby has drank from the breast, there's still milk left behind. And this milk can start to build up an infection, causing inflammation in the breast. We also find with hyperlactation that when babies latch to the breast, the milk flows really quickly. And some babies don't cope with this. So they unlatch themselves a little bit and they become shallow latches. And it's more comfortable for them because that controls the flow of the breast milk. The big challenge with this is that this means that babies now not latch properly to the breast, and they're not going to drain the breast properly either, which increases our chances of having blebs and blocked ducts. It can also lead to an increase in mastitis, and this is where we need to work on the latching to correct it, but it's more figuring out why is baby coming off that breast? Why is baby shifting themselves off the nipple, and why are they not latching properly? For the treatment of a bleb, the suggestions are to use a wet, warm cloth to rub over the nipple area before feeding. Warm and heat helps to open things up. It helps make things expand. So by using warm and heat onto the nipple just before feeding, it helps to open up those cells so that hopefully that milk can drain out. We use a wet cloth because a dry cloth is not going to be comfortable, but also a wet face cloth rubbing over the nipple can gently act as a gentle kind of sandpaper just to try and open up those skin cells so that the milk can then start to flow. So if you've given that nipple a gentle rub and then you latch baby to the breast and we latch them nicely and properly, they'll have a good drink, and that should and can open up the bleb and help it all to flow. Applying cold to the nipple after and between feeds can help with the discomfort that comes with a bleb. Unfortunately, blebs do cause pain. So by applying cold to the nipple, it can help reduce the pain sensation. We don't want to have cold on continuously. We want to do it intermittently. So straight after baby's fed, apply cold to the nipple for 5 to 10 minutes and then take it away. And if you start to experience discomfort again later, you can apply cold again. You can take a prescribed anti-inflammatory, especially moms who've had cesarean section births. They're usually given an anti-inflammatory by their gynecologist after the birth. This anti-inflammatory will be breastfeeding safe and can be used to help reduce the inflammation that is caused inside the breast at this point. Ibuprofen is also safe at the recommended dose that's on the box. Just make sure that you don't take any of the high dose ibuprofens. You want to go for a normal dose ibuprofen. Taking sunflower lecithin for the inflammation in the ducts is recommended. The science behind blocked ducts and blebs, to getting blocked ducts, getting blebs and getting mastitis, actually have a deficiency in lecithin inside their bodies. So by taking a sunflower lecithin supplement, you're just increasing that level within your body. And sunflower lecithin is also a natural anti-inflammatory. So it helps to bring that inflammation down. The great thing about sunflower lecithin, unlike most of the herbs that are used for breastfeeding support, it doesn't have a lot of bad side effects. So completely safe to take with breastfeeding, and it is actually safe to take as a preventative. You can also apply coconut oil to the nipple after feeds 3 times a day. Sorry, my slideshow says coconut, it's coconut oil. So apply coconut oil to the nipple 3 times a day after feeds. Coconut oil has been shown to be antibacterial, antifungal, antimicrobial. It's anti-inflammatory, so it helps with the inflammation as well. And there's been research showing that moms who use coconut oil on their nipples straight after feeding have 62% of these moms have a reduction in pain in the breast. The coconut oil also softens the areola. So it'll soften the areola so that the next time you use that wet face cloth on the nipple, the skin is softer, so it's easier for that bleb to be broken open and to be drained. Epsom salt soaks are really good. You can fill up a bath with Epsom salt and you can soak your breast in there 3 or 4 times a day. There is a suggestion to use the silicone pump to fill that up with warm water and to add Epsom salts. We must just be careful when using the silicone pumps to do the Epsom salt bath. The reason being is that a lot of moms squeeze it quite tight when they attach it to their breast, so it causes a lot of pressure onto the breast and the nipple. The silicone pump is using reverse pressure to bring the milk out. And sometimes what it can do is it can increase the inflammation in the breast. So if you're going to be using the Epsom salt soaks with a silicone-based pump, you want to make sure that you attach the pump very lightly to the breast. And if you find that it's making the situation worse, if you find that you're getting more inflammation in the breast is harder between feeds or after feeding, or the blocked duct doesn't clear, then I would recommend not to use the silicone pump, but just to use warm water in a bowl or a container. You may need to remove a stringy plug from the breast. So if you look at the pictures on the side, the picture in the middle is a stringy plug that's come out once a bleb has opened. What tends to happen is that the cells that build up behind the duct that seal up, it collects milk in there as well, but this milk kind of solidifies, it becomes harder. It almost starts to form into a cheese. And that milk then sits inside the duct. So when the bleb opens, a lot of times we don't see it because baby will be drinking and baby will just clear it. They'll drink it and it's completely safe for them. We don't worry about that. And you may find that after a feed, all of a sudden, the bleb is cleared, the spot's not there, and the breast is more comfortable. If you're a mom who is expressing, though, you might find this stringy bit coming out in your pump. Don't worry about it. You can just remove it. If it does end up in the milk, it's completely safe for baby. You don't have to worry about it. So don't get alarmed when you see it. If you notice after feeding or with expressing this little string coming out your breast, just use a warm wet face cloth to wipe the area to help it drain out. Work with a lactation consultant to address the root cause. So we might need to, as lactation consultants, help to reduce the milk supply if you have hyperlactation. Or we need to assess why the breast is not being drained. What's happening with baby and latching that baby isn't draining the breast properly? Is there possibly a lip tie or tongue tie? We see this very frequently with moms who get blebs often in the early days or blocked ducts in the early days. It's usually because baby's got a lip tie or tongue tie and they're not draining the breast properly. It might be that breastfeeding has changed. Your baby might have started on solid foods and now they're not feeding as frequently. Or occasionally we have these little humans, they like to hold on to the breast while they're feeding. They like to bump it every now and then. They rest their hand on the breast. And we might find that their hand could have caused a little bit of damage. Some of these little ones are very tough on the breast. So we might find, especially with older children, if they're playing with the breast during feeding, they can block off a duct and stop milk from flowing, which leads to blebs and things like that. So then in those situations, we tend to try and find a toy that the child can play with during feeding to keep their little hands busy. Do not pop the bleb yourself at home. A healthcare provider can use a sterile needle to pin through the bleb and help it to drain. But you don't want to pop a bleb at home by yourself. The reason being is that you increase your risk for infection. You're probably not going to use a sterile needle to pop it, which means that the needle could introduce infection. And then once it's been popped, a healthcare provider usually gives an ointment or a lotion that can be applied to the nipple to prevent an infection from setting in. If you're doing it at home, you're not going to be applying that ointment. So we don't want to do that, because not only could you worsen the bleb, you can increase your risk of blocked duct and mastitis. So looking at a blocked duct and how it's different from a bleb, the picture here shows, as I described earlier, these little ducts that are inside the breast where the milk comes from. And a blocked duct is where one of these ducts, the milk doesn't flow and it sits stagnant inside the breast. And if you were to feel your breast, you would find that one section of the breast is harder than anywhere else. It usually feels like a tender, sore lump or a knot in the breast. The tissue around it can get agitated, so you might be tender in other areas around the blocked duct, and we can sometimes see a little bit of irritation on the skin. It usually happens with just one breast at a time. So blocked ducts are different to engorgement. Engorgement happens when our mature milk comes in, and engorgement also happens where baby skips a feed or baby starts on solid foods, and the breast is making the food the baby needs and baby's not drinking it, and the breasts get full and hard. This happens to both breasts, or if it's just one breast, it'll be the whole breast that feels full, where a blocked duct is just one small section of the breast that's full and hard. So what causes a blocked duct? Blocked ducts occur when milk is not drained properly from the breast, and this might again be due to an oversupply issue. I know a lot of moms say to me, is that even possible? Because so many moms struggle with milk supply. They struggle to get enough milk out. They feel like their baby's not feeding enough. They feel like their baby's not getting enough milk. And the funny thing is that an oversupply issue has similar signs and symptoms to a mom that has a lower milk supply. Because with an oversupply, these babies, when they latch to the breast, become overwhelmed with this vast amount of milk that comes at them. So they come off the breast and then they cry, and they latch and they suck, they come off and they cry. So it looks like mom doesn't have enough breast milk. But when we sit and watch and we listen carefully to what's happening, this baby is latching to the breast, and then they go as they're trying to drink this overwhelming amount of milk. And then they come off the breast to breathe because they haven't had a chance to breathe because all they're getting is milk. And as they do to come back to the breast, generally milk sprays everywhere. So we can see that there's an oversupply. An oversupply is also seen when baby is finished feeding and the breast is still full. Then we know this mom might have too much breast milk, and this can lead to blocked ducts because the milk is not clearing properly. Blocked ducts can be linked to bad latch. So if baby's not latching properly to the breast, they're not going to get a full feed. They're not going to be able to drain the breast properly, and it increases the risk of blocked ducts. And this is where lactation consultants step in and help to assess the latch and to help guide you on how to get baby to latch better to the breast. Underwire bras can increase our risk of blocked ducts. This is because the wire can cause a pinch in the duct. And when the wire causes a pinch, it stops the milk from flowing. Then we end up with an increase in blocked ducts on that side. So I've seen moms where they'll tell me that it's always like, for example, the left breast that gets blocked, and it's always on the outer side. Then when you start asking, she's returned back to work, she's still expressing for baby, but because she's returned back to work, she's not wearing a nursing bra during the day, she's gone back to her old bras, and she's now got an underwire bra on, and this increases the risk. The other thing that can increase risk is exercise, and it's not the exercise that causes the blocked duct, it's the bra. Once again, when we exercise, we want our breasts to feel supported. We wear these really lovely supportive exercise bras that can pinch off areas in the breast, causing a blockage in the duct. Skipped feeds can cause blocked ducts. These are skipped feeds because baby's starting to sleep through the night. Baby started solid foods. You're out and about and either baby's too entertained that they don't actually want to feed, or you've got an express bottle that you give baby while you're out, and now baby's missed a feed. Because of that, the milk hasn't been drained from the breast, and this can result in a blockage. Ineffective expressing can cause blocked ducts, and what this means is that using an incorrect pump. So some pumps are more effective than others at getting breast milk out, and if we're using a pump that doesn't drain the breast, we can increase our risk of blocked ducts. If we're not using the right flange size for our nipple size, this can result in an increase in blocked ducts. So we need to make sure that if we're an expressing mom, that we measure our nipples and we accurately determine what flange size is right for us. When we're expressing, we don't want to see areola going into the pump. We want to see the nipple extending, but we don't want areola bulging. If there's areola coming into the pump and bulging, it means that the flange size is incorrect, and you can end up blocking off a duct, which leads to blocked ducts and possibly mastitis. It can be due to a bacterial infection that has got into the breast. We see this often where there are cracked nipples. If there is nipple damage, a crack to the nipple, bacteria can then get in, and then it can cause a blocked duct and an infection inside the breast. So if you have cracked nipples, we want to make sure that we correct the latch so that we get baby latching beautifully, and we want to make sure that we're treating the cracked nipples so that we can help prevent infection from happening. One of the things I get my mums to do is to put on either coconut oil between feeds or an infant probiotic onto the nipple. It speeds up the healing, and the probiotic is good bacteria, so it's flooding the nipple area with these good bacteria that will prevent infection from coming into the breast. Our next cause for blocked ducts is usually stress and fatigue. I know every mom is sitting rolling her eyes now going, of course I'm stressed and tired. I have a new little human who's keeping me awake at night. How am I supposed to stop that one? Well, stress and fatigue is usually not just new momming. It's usually when we have other stress over and above the new momming stuff. It's the trying to plan a birthday party for a toddler, or a holiday coming up, and you've now got to worry about how to get a newborn onto a plane, and the bassinet story, and what about express milk, and can I breastfeed them on the plane? How's that all going to work? Returning to work, because now you're trying to balance expressing for baby and spending time with baby, but also doing your day job. So it's not normal everyday stress and fatigue, it's added stress and fatigue. How do we treat blocked ducts? Ice on the breast after feeding is really great. Cold cabbage leaves that are kept in the fridge or freezer placed onto the breast, especially the blocked duct area, can really help to reduce inflammation. Cabbage has got an anti-inflammatory chemical inside of it that also helps to reduce the inflammation over and above the cold. Latest research is showing that cold cabbage might not be helping as much as we thought it was, but from personal experience, my mums that I've helped who've used cold cabbage say that the cold cabbage is a game changer. It's not anything expensive, it's really cheap that you can get in the shops. What you can do is you can also reuse a piece of cabbage. So take the cabbage, place it on the breast. The moment it starts to warm up and you start smelling that cabbage stew, you can take that piece of cabbage, put it back into the fridge and put a new cabbage leaf on. And you can rotate with the cabbage leaves that you previously used. I would suggest, though, that put the cold cabbage leaves into a Ziploc bag or plastic bag in the fridge, and make sure that people know that this is breast cabbage, not coleslaw cabbage. You don't want to be eating this cabbage. So the rest of the cabbage can become coleslaw or kimchi or whatever you want to use to make it, but make sure that breast cabbage is kept separate. A bag of peas also works wonders, or a bag of frozen corn. The smaller vegetables, if you've got a frozen bag of vegetables, you can put it onto the breast, and because they're small pieces, they kind of can fold around the breast, and you can shape it to wherever you need to place it. The other thing that you can look at is lymph drainage massage. Lymph drainage massage helps to move the fluid around the block duct so that that block duct can open and close nicely and drain properly. What tends to happen is when we've got a block duct, extra fluid runs to that area to support the inflammation. But this extra fluid causes inflammation itself and can make the block duct worse. By doing lymph drainage massage, we help to drain the fluid out of the breast so that that block duct at the next feed can be cleared by baby. I would suggest doing the lymph drainage massage as close to feed time as possible so that that fluid is removed as baby's about to drink so that they can clear the breast. Feed baby often with either the nose or the chin touching where the lump is. This is baby's midline, and it's their strongest plane of suction. If we can get either the chin or the nose to touch that block duct, they'll clear it better than in any other feeding position. This can be a bit of a challenge, and that's why I've chosen this picture. It might mean getting into weird and awkward breastfeeding positions. I had one mom who said to me she used to lie baby down on the floor, and then she would go on her fours, on her hands and on her knees, above baby. She'd get down onto her forearms so that baby could get the breast, but it allowed her to shift her position and change so that the nose and chin could be where it needed to be. Instead of trying to maneuver baby in funny positions on a chair, she just used the floor. This mom's using her bed as a support, and she's leaning over baby on the bed, trying to find, I'm sure that's not comfortable breastfeeding, but it's probably more comfortable than some positions she would need to get into. Epsom salt soaks, again, are very helpful for clearing block ducts. And once again, if you're going to use the silicone pump, use it with care, because it can increase the amount of fluid that's brought into the breast, which increases the inflammation, and it can cause the blockage. If you're going to use the silicone pump, use it very gently to start with and monitor for increased inflammation. Epsom salt is very high in magnesium, and magnesium is one of the nutrients that our body needs to reduce the stress levels and the inflammation in the body. You can take a magnesium supplement orally, but research has found that our skin is a better absorber of magnesium than our gut is. So by using Epsom salt soaks, not only are you getting the benefit of the warm water therapy on the area, but your body is also increasing its magnesium levels to help reduce your stress. Other ways that you can treat blocked ducts: a prescribed anti-inflammatory or ibuprofen. TCM is also a really great treatment for treating blocked ducts. I would suggest, if you get a blocked duct and you have a TCM therapist that you work with, that you see them as soon as possible to help clear out the breast, rather than waiting for it to become something more sinister, meaning mastitis. An osteopath or physiotherapist can do ultrasound treatment on the blocked duct area, and that can help reduce the inflammation. The ultrasound treatment is really great if you have engorgement, like when your mature milk comes in or if baby's skipping feeds. The ultrasound reduces the inflammation in the breast, making it more comfortable. You can express between feeds if needed. So if the breast area is starting to get really hard, and you know it's not time for baby to feed yet, hand expressing or using a pump just to drain that area can be helpful. You don't want to empty the breast though, because that's going to send a signal to the brain that says, I need this milk. And then your body's going to make it again the next feed and the next feed and the next feed, and you're going to end up with oversupply and blocked ducts. So you're expressing only for comfort. And then once again, taking sunflower lecithin can help reduce the inflammation in the breast, and it can help to clear the blocked duct. Things to keep in mind with blocked ducts. There was a guideline that we must put heat onto the breast just before feeding or expressing. As I said earlier, heat makes things expand. So putting heat onto the breast just before feeding, expressing, opens up the breast cells and allows milk to flow easier. We also used to tell moms when their mature milk comes in, get into a warm shower, lean forward and just gently press on your breast and allow the heat to open those cells up and get that milk to flow. Latest research is showing that heat can also increase inflammation. It can bring in more fluid into the breast and it can worsen the problem. From personal experience, I've had so many mums that say that heat just before feeding can be very helpful. And then I've had a few mums who said that they didn't find that it helped. So heat is something that you can use. You can apply heat onto the blocked duct area just before feeding to open up those cells and allow baby to feed. However, if you feel that the inflammation in the breast is increasing, that it's not helping to clear the blocked duct, rather don't do it, then just use the cold afterwards. Avoid over massaging the area. So many moms get told, if you've got a blocked duct, get in there and massage it. You've got to really work it to help that milk move. While baby's drinking, massage hard so that you can get that milk to flow. Unfortunately, that massage can increase the inflammation in the area, and this is going to increase the problem as well. Gentle massage while baby is drinking, a gentle pressure to help move that milk is okay, but we don't want to be getting in there. It mustn't be anything hard. It must really be like not harder than you would be pressing a tomato to see if it's ripe. Massage devices are also usually not advised. These massage devices where they say hold it against the breast and it gives a gentle vibration can increase the inflammation signal in the breast. So when we've got blocked ducts, we want to avoid all the massage devices and things like that. You want to work on the cause. What caused the blocked duct in the first place? And you might need to see a lactation consultant who can help you figure out what was going on. Is it a latch challenge? Is it oversupply? Is it that you've started wearing a bra again, that you're exercising? Is there something else going on that may have caused the blocked duct? And then rest during this period is very important. Bring in support if you can. Like Kathy said, postpartum doula can come into your home. They can help with a few things around the house. They can make you a little meal or snack. They can cuddle your bubs for a little bit so you can get a little bit of rest. And they can also help you just lie in bed and breastfeed so that you can just calm and rest and allow your body to heal. You can breastfeed your baby in bed laying down in a side-lying position. You just have to make sure that all co-sleeping guidelines are very carefully followed for doing that. Alternatively, just get into bed with baby. You can sit at an angle with baby and just have as much rest as possible. When baby sleeps, you can put baby next to you, watch them while they're resting, while they're sleeping, and you can just take time to allow your body to calm down. If you develop any of the following symptoms, you will need medical treatment. So that's a headache, muscle aches and pains, fever, chills, and redness on the skin. These are a sign that this blocked duct has now transitioned and turned into mastitis. When we get mastitis, we have 24 hours for mastitis to clear before we have to be using treatment. You can consult a lactation consultant who can work with you to help it clear. Sometimes by correcting a latch, we can get mastitis and blocked ducts to clear much faster TCM treatment and ultrasound is also highly recommended at this point. TCM can help to cure mastitis. Ultrasound can help reduce the inflammation. If it does not resolve in 24 hours, so you can follow all the guidelines for blocked ducts, and if after 24 hours it still hasn't cleared, you probably need to take an antibiotic to prevent an abscess. If you're working with a TCM or a homeopath or any other doctor, they will guide you as to what point you need to be taking antibiotics. And you can say to them in the first consultation, if I need antibiotics, please let me know. Then they take over the treatment, because I know that TCM is still a form of medicine, and the TCM herbs, if taken over 3 to 5 days, can clear mastitis if it's not a really severe case. So sometimes we can use TCM instead of antibiotics, but if you have been using this, you have not seen an improvement, either go down to your local GP or contact your gynecologist, explain that you have this, and they will prescribe you antibiotics. Don't give up on breastfeeding. If you face any challenges with breastfeeding, it can feel all-consuming. This is because breastfeeding is something that we do not once a day, not twice a day, but 8 to 12 times a day. Every 2 to 3 hours we have to breastfeed. And when breastfeeding is not going well, that can become very overwhelming. But I just want to tell you, don't give up. As a mom who faced challenges with breastfeeding, my daughter is incredibly lucky that I am as stubborn as I am. I didn't give up. I tried to find as much help and support as I could through my breastfeeding journey. And I can tell you that when we got through the challenges, breastfeeding became the most amazing thing I think I've ever done. It was such an incredible tool for bonding with my daughter. It was such an amazing tool to get her to sleep. Even as a toddler, when she was running around and it was nap time and I thought, oh, I don't know how I'm going to get this child down, I'd say to her, hey, babe, let's go lie on the bed, read books. And then when we get to the bed, I'd say, do you want milk? And she'd, And then I'd latch her, and within minutes, she was fast asleep. I cannot imagine having to get a toddler to sleep without the breast. It was my absolute go-to tool every single time. Breastfeeding becomes this tool that you've got for when they fall and hurt themselves, when they bump themselves, because breast milk has these properties in it that help with pain. But not just that, you bring your baby back to the comfort of mom. So if you face challenges, don't give up. There are loads of professionals out there who are trained to help you. Lactation consultants can help you. The physiotherapists and the osteopaths are really helpful on breastfeeding journeys. TCMs can be there. Postpartum doulas and your birth doula can be a really great support to help you through breastfeeding challenges. So please just bear that in mind, and I hope you found this helpful.
Wow, so good. Thank you so much, Laura. And I think you touched on nearly every struggle and probably everything that I tried actually along the way. And ultimately, I ended up doing pretty much everything you advised to be done. Yeah, like so useful. And I think for anyone that hasn't suffered this yet, you are so lucky to have listened to this and like kind of have this information up your sleeve, because that quick action at home by yourself can just be life-changing, can't it? It can really, really impact how fast they can solve these problems. I don't know how many times we hear of mums having kind of not reacted quickly themselves, gently with these methods. And then when they've gone to the doctor, antibiotics are the only option, or medication or something that we could have avoided if someone had been able to tell them that there are some gentle things that they can do at home themselves. In particular, lecithin. I know you mentioned that, huge part of my journey. Once I discovered it, I was like, yeah, that's definitely helped me. And you made me laugh with the photos of the dangle feeding.
Yes.
Oh, you made me laugh. You made me laugh so much. Dangle feeding. That was my go-to when I had a really bad blockage. And I always tell mums, if they're doing it, you just need to tell everyone in the house what you're doing, because sometimes people, like my husband would walk in and he'd think I was suffocating the baby because
Yeah.
I would be in such a bizarre position over the top of her, my bum in the air, facing the door. But it worked a dream sometimes, really getting that right position where her chin and her nose obviously were the right side, the right side for where the blockage was. That really, really helped me. We have a question in, Laura.
Okay.
What if you're exclusively pumping because baby doesn't want to latch?
So exclusively pumping mums who tend to get blebs or blocked ducts, it's usually because for some reason the breast didn't drain properly with expressing. So it could be that I've seen it sometimes mum's in a bit of a rush and she's like, well, I've got enough mils out, I can just leave it, and she carries on with her day. Or what we tend to do is while we're sitting with the pump on, sometimes we get distracted. So we're trying to hold the pump in place and we're getting distracted by something. So our hand drops and the pump shifts and it puts pressure on one part of the breast. Or I've seen moms who press that pump so hard into the breast that it's blocking ducts. So we've got to make sure that when we're expressing that we have the pump gently against the breast, that we're not losing focus when we're holding it in place and we don't shift it so that it's in the wrong place. We need to make sure that the nipple goes into the center of the flange, because if the nipple goes in on the side, it pulls in breast tissue on the one side, which can cause a blockage. And making sure that the flange size is correct is also very important.
Yeah, you saying about holding the pumps in place, the flanges in place, that is still something I shouldn't be surprised, because it's happened to me so often when I've gone into clients' homes and I realize that they are manually holding a double pump or even a single pump, but especially a double pump. And obviously that's quite restrictive when you're sitting down. I mean, a lot of the hospital grade pumps anyway are quite large and restrictive in terms of what movement you can go around. But then I see mums holding their flanges. I was like, oh my word, we need to get you a correctly fitting hands-free pumping bra, so that pressure on isn't too much, that it's not too tight, but it's also not too loose, and that they can get that really nice central positioning without holding on to their flanges, so that they can actually, yes, I know the Spectra is a bit like a bowling ball, but at least you can pick it up, you can walk around, you can put it on the kitchen side, you can put it on the sofa next to you, you can put it next to the nappy changing table. At least then you can move around and still do some things. So yeah, definitely for the person that asked that question, if you are holding your flanges, please do go out and invest in a hands-free bra. You can hack them.
Yeah, I was going to say, can I just give a hack for the hands-free bra? Because they are very expensive. And I'm the frugal breastfeeding mom. I'm kind of like, I'd rather spend my money in other places. Breastfeeding's supposed to be free. So with the hands-free bra, if you get a looser fitting exercise bra, so exercise bras are supposed to hug us really nice and tight. If you get a looser fitting exercise bra, really cheap from Decathlon, you can get the sale ones. You cut holes, you measure where the flange is, you cut holes, you put it on, it holds it all in place, you don't have to do anything. It's much cheaper than the actual hands-free bras. And if you find that it's too loose or too tight, you can always just go one size bigger or one size smaller without having to spend massive amounts of money.
Yes, absolutely. Absolutely. A little bit easier to do if you've got a medalla, because the flanges, or they've got just the little tube attached, whereas the Spectra has got like the whole gummages that you have to kind of get through the hole that you cut.
I do tend to find that, I know there's hands-free pumps and you pop them into your bra and you can carry on with your day. I do tend to find that they're not as effective. They don't drain the breast properly. And we end up with more blocked ducts and blebs with moms who are using the hand-free pump than moms who use a hand-free system with a more effective pump.
Yeah. Do you find people using the hands-free ones, like the ones that slot into a so-called normal bra or normal nursing bra, pressure-wise, they might be wearing it too tight or they might be wearing it too loose, because you're relying on a normal bra holding quite
a big device.
Yeah, like they market themselves as small, but they're still, you're still
Big.
around like Madonna. Right?
Yes.
Showing my age there, talking about Madonna. Some people probably don't even know what I'm talking about when I talk about Madonna and pointy boobs. We have a question: how to unclot underboob?
So sometimes we find that the breast doesn't drain properly because of the shape of the breast. So we've got some mums who've got boobs that have got a little bit more of a droop to it. And it's natural, it's just the way we're made, because breasts are all different. Sometimes placing a rolled up face cloth under the breast can take that droop and flatten it out. And that helps to drain the breast out nicely while baby's feeding. So if you've got a blocked duct underneath the breast, by putting a face cloth there to just make it flat, can help drain the breast. The other thing is, it's then about position. How do we get baby into a position where their chin or their nose is touching that part of the breast? One of my favorite for that is the koala bear hold. It's where you have baby sit upright on your lap and then you latch baby. And this can be done with newborns, and it doesn't have to be a toddler or a baby that can sit. You're just adding in a little bit of extra support and holding them in place, but having them on your lap sitting upright, their chin is then not just in line with the under part of the breast, but it's there massaging the breast while they're drinking as well.
Yeah, and I find, generally speaking, actually just what I call hands-on breastfeeding, like having your hand under there, if you can just take that extra pressure, because in the nicest possible way, boobs are heavy, or they can be depending on their size. And little babies' mouths, they're only little. They've only got so much kind of strength in the muscles around their jaw and to hold. So if they're trying to defy gravity and feed at the same time, giving them that little bit of extra help sometimes. It's certainly my one, it helped her if I would take a little bit of that weight, that underweight for her sometimes. Also, if anyone, have you heard of the product Tartar Towels, Laura?
No, but I can only imagine what it is.
Oh, anyone out there that is blessed with a larger up top, and especially with the humidity here, if you're finding that you get kind of, sweaty and hot kind of underneath, look up Tartar Towels, TATA towels. I'm not big enough to justify getting them, but I wish I could, because I just love them. I love the promotion as well. It's so much fun. So homework for the ladies with the larger breasts. Go see if you can treat yourself to Tartar Towels. Well, thank you, Laura. Thank you so, so much. We get a really, really good response when we provide breastfeeding, evidence-based care, guidance and advice. And you've absolutely excelled again, helping mums and dads. You can share this with your partner so that they can learn more about what you are experiencing and how they can help you. This is why we try and bring this information to you in different formats so that you can use it, share it, and it's there available for you when you need it most, whether that's during the daytime or whether that is, the 3 a.m. feeding time. You can put your earpods in and you can listen to this. So a huge thank you, Laura. Really appreciate your time. Really appreciate everyone logging in on the live event, because that really helps us deliver personal information to you. It really, really resonates. So thank you once again, and have a really, really lovely day. Bye, everyone.
Bye, everyone.